this segment of my channel is going to be on updates on the mental health industry generally, but in South Africa, right? I might find articles from different places or information or videos or whatever from different places, but I'm going to try as much as possible to focus on what's going on with us in South Africa. I haven't found people speaking as much about stuff that's going on in South Africa. So I'm going to start with whatever article that I can find and just discuss it with you guys. And just to keep you in the loop on what's going on in the mental health space in South Africa. And yeah, so I had read through some articles and did like some lives on TikTok and whatever. But when I come to like YouTube to come get like long form content or to save some videos for that have like a bit more information, I haven't been able to find anything. So I'm just like, okay, fine, let me just start doing that. Also, with holding my mic, I have judged people before that would hold a mic on like a wooden spoon until I realized how sensitive mics are. And I'm not wearing any jewelry. Maybe I can still just do that. Am I still going to see the green light? Yeah, I can still see it. Okay. I'll do that because anything that it touches, the mic picks it up, and then you only hear it in the middle of your video that there's so many clinking sounds in the background, and it's not fun to hear. But I'm going to be checking on it a lot because it tends to, yeah, but I charged it. Okay, green lights, we're still good. Still good. All right, let's get into this first article. The one that I just found today is by Yoliswa Sobua, and the website is healthe.org.za. It is the latest one that I first bumped into May 13, 2025. Headline: 90% of South Africans with mental illness go without care. How scary is that? We know that a lot of people that struggle with mental illness, I think that's a general understanding, just go without care. Sometimes it's where the state of their mental health is at, it makes it difficult for that person to understand and believe that they need to get care. Sometimes it's people that have tried and did not meet with people that gave them grace or understanding, and they just decided not to try again. It can be a subject that a lot of people are being judged for, so it's a bit of a difficult one. So I do understand, but it is heartbreaking that it's not like an open enough situation. The other time I was speaking, when we went to go get our antidepressants at the local clinic, it's in the vlog before the one that I just posted. If you want to see where we went with my husband. And one thing we were talking about while we were at the clinic was like, there isn't even a poster that shows like signs or something for deaf people. And that makes me feel like someone that is deaf wanting to come to a public clinic might already feel like this is not the place for them. And now having to speak about mental health makes it even difficult. And then I spoke to another friend who works at a school. She's a teacher and she teaches deaf kids. I don't know if I'm saying that right, but I hope I am. At a school in my area, and she spoke about how difficult it is to speak to people in the deaf community about mental health or mental illness, and that even in sign language there isn't a specific word for depression, so she'd have to describe it as stress for long periods of time, and it doesn't really describe it properly. But anyway, I'm going on a rampage. I really get stressed out when I feel like not everybody gets to get the care that they deserve because of being judged based on this thing. And it's not something that anybody should be judged on. It's not something that's supposed to be so difficult to get care for. Like if it's so easy to get care for flu, mental illness is just as easy to catch, basically the way you catch flu. I wouldn't say catch, but it's such a big problem that it should be a much smoother process to get help with it. But anyway, all right, diving into this article, 90% of South Africans with mental illness go without care. So let's hear what Uyoliswa Sobua says in this article. All right, South Africa faces a high burden of mental health disorders driven by a range of factors, including childhood trauma, poverty, unemployment, the ongoing impact of HIV, and a history of political and social violence. Yeah, there are some things that go into our history as South Africans that even though we are in a different direction and in a different place right now, it's there's a lot of trauma that has happened that people can't just move on and just go forward, right? I think the newer generation like Gen Z and Swashe, Swashe, kind of after Gen Z, what comes after? Gen X is the older ones. That's like money there. Gen Alpha. Thank you. Can you put them back on? Thank you. Gen Zs and Gen Alphas, I think, are in a much better place. They have much more open conversations, right? But we're still living with many other generations that, because of our history, it's quite difficult to just erase and act like we don't have all of that trauma. Research shows that 30% of South Africans experience a mental disorder in their lifetime, yet most of them won't get the care they need. I worry because I feel like most of us, it might even be all of us, know somebody that is struggling with mental illness, not even just their mental health is declining, but struggling with mental illness. People we see in our communities that get out on the street and do things that you can see this person, it's not in their natural state to be doing whatever it is that they're doing, and they're just not getting the care that they need. It's getting to me again. Okay. There's a clear epidemiological evidence that 16% of South Africans experience a mental health condition in any given year. But more than 90% of people living with mental health conditions don't receive the care that they need, despite clear evidence of cost effective intervention, says Professor Craig Lund, who is the co director of the Centre for Global Mental Health at King's College in London. Oh, King's College London. So maybe there's a department of King's College London here in South Africa. Okay, anyway, but that's what Professor Lund says. At the heart of the issue seems to be a lack of investment and failure to implement policy. Okay. South Africa spends only 5% of its health budget on mental health, and most of this is allocated to inpatient psychiatric and not community mental health services. That is sad. 5% of the health budget in SA. 5%, we're only getting 5%. Like, I mean, I knew I'd read other articles and I knew it was really low, but 5% of the health budget is, and most of it is being spent on inpatient psychiatric, okay, allocated to inpatient psychiatric. So if you are admitted at a hospital, that's where most of the budget goes to compared to the community at large. First of all, as South Africans, we know the state of our public hospitals. There are really great ones out there, but there are also other ones. I was admitted at Tambo Memorial. The 5% health budget that is going into mental health in allocated to the inpatient psychiatric part of things at that hospital, they are using 1% of that 5%. They are, Yo, it is bad. Yo, it is bad. Yo, it was bad. Yo, it was bad. And it was so sad because the people that were there, the nurses that were there that were meant to care for us, seemed like genuinely good people. If you were to find them outside anywhere else, they would probably be nice, helpful people. But there, where they knew that they were dealing with vulnerable people, they had so much fun just being brutal, just being mean, just being. It is so disgusting. Like, you go home every day knowing that someone vulnerable, you just made sure that you put them in a state that's even worse than how they came in. And you are proud of yourself. And you're just like, I did my job for the day. Yeah. It's like Hayatria Tambo Memorial, Asham, an experience never to be forgotten. No, the ceiling was leaking and it was raining into on the beds, and the nurses are video calling their family members. I remember it was on Christmas Day. They were video calling the family members and showing off this other patient that really is not okay, and they were making fun of her. And oh, disgusting behavior. Definitely one dot of that 5% that's already tiny in this country is being used over there. It is so sad. We completed a national mental health investment case for the Department of Health and National Treasury. It clearly shows that economic return on investment through improved labor market participation and productivity as a result of receiving mental health care, says Land. I don't understand what I just read. And I just read it again. We completed a national health investment case for the Department of Health and National Treasury. It clearly shows the economic return on investment through improved labor market participation and productivity as a result of receiving mental health care. There's an improvement. I have awkward things to say about that, but statistics are statisticking. He provides an example. For every R1 invested in treating adults' depression, there is a R4 return over 15 years. Okay. Investing in care for perinatal depression yields an even higher return of R4.70. So, from an economic standpoint, investing in mental health care is a sound decision that will benefit the South African economy in the long run. That I agree with that. I do believe that investing in mental health care would contribute really positively towards the economy of South Africa in general. If the people that are helping run the economy are not doing well and having a lot of days that they had to take off because of the mental health struggles, then how do we think they're going to how do we think economy how? So makes sense. I just I'm not that good with like figures and numbers, and this segment is supposed to be for my husband. He's the one who has calculates all of this. He must take numbers and break it down into a language that I can understand, because he has an engineering brain that can deal with a nail technician's brain. All right, so they showed like a template here. Figure 6, patients seeking care per 100,000 population by province over time in the last 3 years. This is in 2023, 2022, and 2021. And let me see. Okay, so they're showing Eastern Cape, Free State, Gauteng, KZN, Limpopo, Mpumalanga, Northwest, Northern Cape, and Western Cape. I'm going to try to find this thing off of my laptop and just patients seeking care per 100,000. Okay. In the Eastern Cape, 2021, there was more people Then in 2023 and 2022 were just about the same. And okay, but the province that seems to have a lot more people. Yes, this a table from the mental health situational analysis shows that from 2021 to 2023, there's a noticeable increase of patients seeking mental health care at outpatient facilities in most provinces. Okay, that's a sentence that they just put under this graph. But the province that seems to be doing a lot in terms of seeking care, patient seeking care, is Northern Cape and Eastern Cape. Slightly under that is Limpopo. Okay, and then the lowest is Northwest. And just above Northwest is Mpumalanga. Slightly above that is Western Cape. Gauteng and us here in the Free States. Okay, but KZN is above us. Oh, guys, okay, but you know what? Just to see improvement is a great thing, especially in Limpopo and Northern Cape from where they were to where they from where they were in 2021 to where they were in 2023. Improvements. And I mean, it's a great thing to see. I think it's just that the 5% is one thing that just threw me off. It's just a heartbreaking thing. And when you get to a public hospital needing to be an inpatient, you see it. You see it. Because when I got admitted to Tambo Memorial, we went to a few other hospitals. We went to one in Santon, I forgot what it's called, but they were all public hospitals. Went to Charlotte, went to another one, because by the time I got admitted to Tambo Memorial, I think it was the fourth or fifth hospital that we were at in that day, just trying to get admission. And the Santon one is the only one that, in fact, it was suggested to me by another lady who was a nurse, a client of mine who was a nurse, and it looked good. We didn't get inside, but the others we got to go inside, and hospitals are looking good, fine. Even Tambo Memorial as a hospital, right, my outside. I remember when we got to the parking lot, my sister's like, "This looks like an asylum." I'm like, "No, it's a hospital." But I'm going to be in the asylum part of the hospital. Yeah, that one kind of looked a bit, but I mean, clean-ish, fine inside. It was okay. But when you got to the mental health side, yeah, then you will see, ah, traumatic. You're better off at home, which is sad as well. Because sometimes home is not what you need at the time you need to be. Okay. Mental health policy. Casey Chambers from the South African Depression and Anxiety Group tells Health E News that while South Africa was or has progressive mental health legislation, implementation remains a significant challenge. I think I would agree with that. I think there can be great legislation and paperwork and whatever, but if implementation is not being taken seriously, then, you know, already I remember a client of mine having been admitted at a private facility, and she met one or two people that were working there, staff members that were working there, that just didn't understand how to treat people that are there, you know. But for the most part, I mean, generally, if you're going to get into a place like that, you're going to find a lot of people that are doing good and a lot of people that are doing not so great, right, in any place. So, I mean, that was dealable with. But in the public space, there's only so much paperwork can say. If there isn't anyone that is passionate enough about this thing, that is going into these facilities and making sure that they're using that 5% to the best of their ability, then implementation remains a significant challenge. Okay, the biggest issue is that we have these documents that outline an overall vision for mental health, but if they are not budgeted for, not implemented, and if there's no task team to drive them, they fall short. Yeah, Chambers, I understand you. Ooh, sorry, Mike, are you still on? Oh. Chambers, I understand you. We understand it. Okay, points out that since the 2016 Life Esidimeni, oh, Esidimeni tragedy, which left over 140 mental health care users dead after they were transferred to unlicensed NGOs in Gauteng. Many of the promised reforms, which include increased staffing and training, improved mental health infrastructure, and stronger oversight and regulations, have yet to materialize. Problem at 2016. Namanje, guys. Namanje. Yet to This is an article from now in May. Namanje, yet to material. My heart palpitations. Okay. We're still not seeing meaningful change for the average patient. So one has to ask what something like the mental health policy framework and strategic plan achieves for the person on the ground, she adds. This is all what Chambers says. It's working. Nalona Chambers, we have an understanding because quite a while. I actually want to open these up. I want to see mental health policy framework and strategic plan. I actually want to see it. But okay. The 2023 to 2030 National Mental Health Policy Framework and Strategic Plan highlights key areas that need to be addressed to improve mental health care. These include better funding and planning and making mental health part of regular health care. Makes sense. Okay. However, stakeholders have raised concerns about the lack of urgency in turning policy into action. For example, key recommendations in the 2013 to 2020 Mental Health Strategic Plan have still not been implemented. Guys, 2020, if it delay, like 2020 is within our history. How far? Still not. I'm gonna have a breakdown. This is actually breaking my heart. I'm correct. I'm gonna have a. Bharti Patel, National Executive Director of the South African Federation for Mental Health, says the Mental Health Strategic Plan clearly states that community-based mental health services will be prioritized to ensure that care and services will be accessible in communities. However, provincial health departments have not increased funding towards community-based mental health services provided by NGOs. Government funding has been cut in many instances, leaving community-based NGOs to source alternate funding so that communities are not left destitute, Patel says. It's like there's a reel that not a reel, like a TikTok that I put up a few days ago, where I said the way the government is moving, it's almost as if they're saying like if we just forget you for a bit, you'll probably be okay eventually. You'll get past this. The government seems to be relying so much on NGOs, and NGOs are trying to get the backing of governments but end up having to go outsource funding. The community at large, a lot of people, a lot of companies are willing to invest a lot into their mental health space. I believe that, and I've seen that. But it's just sad that the government is almost just like, okay, you guys struggling with your mental illnesses, mental health, hey, just go to your friend there at the corner, and let them figure out what to do with you. Not cool. Not great. Life Estimini, remembering the 144 dead mentally ill patients. The Life Estimini online memorial and advocacy project website was launched on Thursday, 20 May to mark Mental Health Action Day and to keep the stories of the 144 ill patients who died alive. I did not know about this. I want to see it. It's just so mean. It's so sad, man. You know, mentally ill people, it's not their fault. It's not because you want to be that way. And everyone wants to be able to take care of themselves to the best of their ability and to do everything on their own. But they just can't, and they have to rely on other people, including the government. And 144 of them dying. Factors contributing to poor mental health. Lunt says that there is good evidence that poverty and mental illness are linked in a negative cycle. That makes sense. On the one hand, living in circumstances of poverty increases one's risk for mental health conditions through stress of financial insecurity and food insecurity, as well as increased exposure to violence and increased risk for other health conditions. True. He says living with mental illness increases one's risk of drifting into or remaining in poverty because of the cost of healthcare and the disability and stigma associated with mental illness exclude people from work. Okay, I feel like I didn't read that sentence properly. But anyway, the disability and stigma associated with mental illness excludes people from work. I understand that. I understand that. I think even I know that just speaking about having been admitted and being on antidepressants and stuff like that, people generally just don't say that. And I know with my husband and I, we are very much on we're healing out loud so that the next person can feel that it's okay for them to work on their healing and that they are not alone. So we're just finding it as our assignments to just be like, we're just going to make sure you understand that you're not alone. That's it. And but we know that we are at the risk of being looked at a bit awkward because of the stigma that is associated with mental illness. But there's a lot of people on medication, people just don't speak about it. There's a lot of people that went off of medication for different reasons. People just don't speak about it. There's a lot of people that want to get back on medication but are worried because they were misdiagnosed at some point, but they just haven't gone to. People just don't speak about it. So there's a lot of words that go into it, and there's a lot of people that just need to know that they're not the only ones and they're not alone. And but the stigma is a difficult one that makes it difficult for people to continue. Okay, let me look for steps to ensure successful policy implementation. Okay, I hope I feel better after because that 144 people, I'm not too sure I'm going to have the capacity to go through that article right now. That's something for another day. We'll get back to that. Okay, steps to ensure successful policy implementation. Land highlights three critical aspects of the 2023 to 2030 mental health strategic plan that must be implemented urgently. Firstly, district mental health teams need to be established to coordinate the plan, the local delivery, to coordinate and plan the local delivery of mental health care through primary care clinics and community-based facilities. Okay? Second, national training and supervision of general healthcare workers in mental health competencies. Oh, should be rolled out across all primary care settings and facilities. Right? Third, it is important to implement mental health promotion and prevention programs in schools, yes, particularly targeting adolescents who are at a crucial development stage. Absolutely true, especially the third one. Absolutely true. There's a lot of kids that by the time they become young adults, and even going further, they've already gone too far into substance abuse for the most part, just because they were trying to deal with their mental illness while they were at school, and they just had nowhere to go or no real understanding of what is really going on with them. Why are they so different? Or what's just happening? So people, a lot of kids just go straight into substance abuse. If there were enough programs in schools, and a lot happening just in spaces around adolescents, I think it would be really helpful. I feel like I need to find this Yoliswa Sobua. I need to find her. I need to find her. She did something great here. And she's so pretty. Oh, she's so pretty. Oh, I like her. And she's smiling. Oh, okay. That was the article for today. That was it. I just wanted to read that with you and just go through it with you, whatever article that I find. And please do let me know what you think, what you understand, what you don't understand, what you'd like to hear more of, and anything like that. But I'm going to continue to be doing this, no matter the feedback that I get. I feel like there are people that might need to hear this type of information. So I'm going to continue to go through these articles and just bring the information to you so that you know what's really going on. Oh, this is journalism for public health. Health e-news, journalism for public health. Oh, so that's what health e-news is. healthe.org.za. Okay, shop. Please do like. It will help YouTube see that somebody needs to see this. And I do think somebody might need to hear this. Some validation, some information. And then if you're happy with what happened over here, you're happy with my contribution to this mental health community, please also do consider subscribing to the channel. And I will see you in the next one.